Hi, I'm Dr. Yvette Suarez, and I wanted to tell you a little bit about my story. It's a very personal story, but I thought I should share because I am the 1 in 8 women that gets and had breast cancer. So I feel like it's a little bit of a long story, and I will try to do it in 3 parts so that I can share and hopefully make an impact in someone's life and help them through their journey. So about a year and a half ago, I was diagnosed with breast cancer. But what does that really mean? How did that all start? How did I find it? So as you know, women, we should have a mammogram done every single year. Most of my life, I've had little cysts, so I've been pretty regular in getting mammos and ultrasounds to follow. So one evening, when I was laying in bed, I felt a little tiny pea-sized mass on the outside of my right breast. And it was odd. I was watching TV and I was playing with it, and I found myself playing with this little thing that was a pea size, and I thought to myself, that's a little odd. Typically cysts are painful, adenomas are painful, and I didn't think much of it, but I said, I should probably get this checked. I decided to call my doctor and ask for a mammogram to be ordered. So about 2 weeks later, I went for my mammogram, and during my mammogram, they couldn't find it. Imagine to my surprise. I kept saying to the lady, it's right here, I can feel it. Check again. And so what was happening was the tumor was so close to my rib cage that they wouldn't be able to push that breast tissue actually into the mammogram. So right after that, I said, okay, can we get an ultrasound? So they went and ordered an ultrasound, and they couldn't find it, but I said, here it is. It's right on my rib cage. It was almost so far out, I wasn't sure if it was part of my breast tissue. And sure enough, on the ultrasound, they found this little tiny thing, and nobody really blinked an eye or thought anything of it. So I said, okay, I'll just, follow up with my surgeon and see what it is. And so I found a surgeon that had said I can come to the office and they would biopsy it and we would be done. So I make my appointment a few weeks later, and I go into the office and I'm ready for this biopsy. I want to know what it is, and I want to put it aside and move on with my life. So she walks in, she examines me, we go over my history, and she's like, well, you're pretty healthy, and I don't have a lot of risk factors. I do have a grandmother that had breast cancer and an aunt, both over the age of 50, so she didn't think my risk was very high. So we talked about different options, and you're gonna probably face this also, and most of the options is, let's just wait 6 months and see what happens. Let's see if it grows. Let's follow it and just see. Second option was, let's go get a mammogram, MRI, and the MRI will see what size is the tumor, and are there any other abnormalities in the breast that we couldn't find. And then the third option was to do a biopsy. So she didn't want to do the biopsy in the office. She said that it was so small and so close to my rib cage that she was afraid of injuring me or causing a puncture. So her recommendation was to do an MRI or just watch and wait. And typically, honestly, I'm not a paranoid person. Having so many cysts and having a few biopsied throughout my adult life, I really thought 99.9%, this is nothing. I honestly just wanted to check it off my plate so I wouldn't forget it. I know how busy life gets, and we get so involved in everything else that I knew that would fall to the wayside, and it may take a year to go back and evaluate this, and I just thought, I really just want to take this off my plate and find out what it is. Let me know it's nothing and I move on. So I asked her to opt for the biopsy, and again, she talked about, it's painful, there's risks, and I kind of laughed because knowing what I do for a living, that I put needles in people's faces all day, I'm definitely not afraid of a needle. And so I thought, this is fine. I will actually just opt for the needle and get this going. So it's definitely a little harder to talk about than I thought it would be. I think I get to a place, and most people who know me, I'm a very strong individual, and I put things in a little box and I deal with it when I need to deal with it, and I kind of go through my day. But I think thinking about how everybody reacted to this really, it really hurts me, and it's, it saddens me to see the people around me care and suffer with me. So I knew I had to tell my mom and my kids, and I knew that would be a problem. I had recently lost my dad a year prior, so I didn't want to tell my mom. I didn't want her to think that she would lose me.